and until such time as we do get to that peak of the pandemic. Overall, I think that, I'm heartened to hear some of the stories and what people have done to try and, decrease their overall risk, within the community. We have schools that are closed. We have individuals that are working from home. We have other folks who are, practicing good social distancing, which is, staying away from other people and keeping about 6 feet space between you, one another.
You mentioned the 6 feet, and a Facebook viewer had just asked that new MIT research suggests that 27 feet is a safe distance better than 6 feet. Is that recommended by the CDC, or have you heard much about that?
So it's not something that is typically seen when you're talking about the primary mode of transmission with COVID-19. What we know is that an individual, as they're talking or coughing or sneezing, every time you do that, there are little droplets that are expelled from your mouth, and they do hang in the air a little bit, which is why we go even a little bit further than arm's length when we're talking about how far some of those little droplets will travel. But it is standard that the infections like this that are primarily focused on droplet transmission, which is that droplets being the main source of spreading it, is 6 feet. What that other research might be talking a little bit about is some of the particles that can stay suspended in the air a little bit longer. That might be resulting in some of the MIT modeling that's out there, but that is not kind of the common practice.
There's a lot of talk about the shortage of supplies, and some people are making masks. And there's also talk about whether we should all be wearing masks when we go out into public. How do you feel about all the masks? What would you recommend everyone wear them?
So I think it's important to remember that, why do we have masks? And the important part is that individuals in the community, are not really helped by most of the masks that are used in healthcare. We have specific masks called N95s that are actually respirator masks, and those are designed and needed to be fitted to a person's face and are most often used by healthcare professionals. There are other that are surgical masks that simply provide a barrier between somebody that might be ill and yourself. And there are particles that potentially can work this way around the mask as you're breathing in and out. So you need to think about it as just a simple barrier, really, to help avoid some of those small droplets, that might be expelled from somebody as they're coughing or sneezing from getting into your mouth. But overall, the general consensus is that masks are not used widely because they really do need to be reserved for healthcare professionals and for ill patients.
And it would seem the safest thing is to stay home.
That's definitely true. Whether you're talking about staying at home because you are showing symptoms, or whether you're talking about staying at home and practicing social distancing, both of which are very effective at helping prevent illness.
Thank you. Well, today's COVID...
When the Civil Protection Agency here puts out its statistics, people are holding their breath to see is it going to get better or isn't it? And certainly over the last few days there has been something of a cautious sigh of relief, but not everyone is convinced that the worst is over, and certainly the numbers may be somewhat deceptive. Some Italian officials are saying that the actual number of reported cases, as opposed to the 100 in the teens, 1,000 cases, it's actually around 600,000 cases, but many people either show very few symptoms or no symptoms at all. And of course, they're the biggest danger in terms of spreading the virus. Sanjay?
And Leader and Ben, thanks very much. Sanjay, we're going to take a quick break. When we return, Dr. Anthony. with options starting at just 9.
That's an act on the books from the Truman administration, and it says that the military can commandeer both manufacturing and distribution when there's a national emergency or a war. The president said he'd do it, and then 3 hours later he said no. And now he hasn't done it, and we sort of have this patchwork where governors and mayors, my governor, my mayor, they're doing good jobs, but they're going around looking for ventilators, looking for masks. It's uncoordinated, and it's a patchwork. So this morning I sent the president a letter and said, why don't you invoke the Defense Production Act and put in place a military person, somebody who knows command and control, someone who knows logistics, someone who knows quartermastering, to not only commandeer factories and supply chains to make the stuff that we need, desperately need, but also to distribute it in the places that are most needed, so not the 50 governors will be hunting and pecking. And then I spoke to the president late this afternoon and explained it, and the result is this letter. And so I'm just appalled. You know, I'd say to the president, just stop the pettiness. People are dying. And so, President Trump, we need leadership. We need to get the job done. Stop the pettiness. Let's get it done. Let's roll up our sleeves. I sent the letter with the best of intentions, trying to improve a very bad situation that Dr. Jha was talking about a few minutes ago.
You know, it's come up a lot in our reporting, and people I've been talking to both on the show and elsewhere about how haywire and insane this market has gotten. There's all these...
Even more. I think we could get out of this in a matter of 2 months if we focused. But we're still not focused.
Right. Dr. Lipkin, thanks very much for coming up.
I mean, you're one of the people, Tucker, who really brought this to the fore. And I'm grateful to you for doing that and being as outspoken as you have. And I fully support what you're trying to do, which is to reach a broad swath of the American people. We will get through this, but we have to do it together, and we have to do it with thought.
Well, I agree with you on the last point, and I'm just concerned about the cost and the long-term effects of this. It's starting to scare me. But I think you make some really thoughtful points. Yep. Doctor, thanks a lot. I appreciate it.
Thank you. Yeah, bye-bye.
So Alex Berenson is a former New York Times reporter who wrote a fantastic book that we featured a couple of times on this show. But for the last month or 6 weeks maybe, he's been deep into the numbers. As a layman, but a highly informed one. And we wanted to talk to him tonight for a counter view on this question. Alex, thanks a lot for coming on tonight. So you've heard, of course, the case that Dr. Lipkin made, and I thought it was a pretty restrained, thoughtful case, but it's a kind of variation of what we've been hearing a lot. What's your opinion of it?
So here's what I would say. I'm not an epidemiologist, okay? I'm not a scientist. And to some extent, I come at this from the same perspective that I came at when I wrote Tell Your Children, which, as you mentioned, we talked about a couple of times, which is I'm a journalist. And what I think I'm pretty good at is seeing whether what people say lines up with what's really happening. And unfortunately, what we are seeing, and what we have seen for the last couple of weeks, is that the models that have predicted really apocalyptic things in places like New York City and nationally and in the UK don't seem to be matching what's going on in reality. And in some cases, these epidemiologic models are extremely new. They've gone extremely south in a matter of days. And so I think we really have to ask what's going on here and whether or not there are strategies that might be less damaging to the economy that would do just as well, because we've taken huge steps. We've put 10 million people out of work, more actually, because that's the official numbers. In just a couple of weeks, we've caused real societal harm and disruption, and we've done it on the basis of models that don't seem to line up with reality in real time.
So let me ask you, and this is a conversation we're going to continue on this show, and we're going to do something on it tomorrow, taking a look at what the predictions were and what the outcome has been, because it's important to keep track. But just give us a couple of examples of what you're talking about when you say the models haven't produced accurate results.
Sure. So the most recent one is the University of Washington model, which was created and released only a week ago, and as of today, predicted that as of today there would be about 50,000 people in New York State hospitalized with coronavirus, and there are about 12 or 13,000. So this is a model that the numbers in a week have been off by a factor of 4. And that's also true for ICU beds. I think the delta there is about 3 to 1. Meanwhile, there's a state model actually in Oregon that's gotten very, very little attention that was just revised on Monday to show that if Oregon did nothing, if it ended the lockdown, this is the state's own prediction, is that there would be 90 people in ICU beds at the beginning of May. This is a state with more than 4 million people. If the lockdown continued, there'd be 30 people. So that's about 2 people a day different being in ICU versus not. And the question is, are we going to lock the state of Oregon down, cause real societal disruption? In some cases, close schools, force kids, to be home with parents who in some cases may be very stressed, maybe abusive. They're going to be out of sight of teachers. I'm very, very worried about the domestic violence and the child abuse implications of what we're doing.
I agree. I agree. And the alcoholism and the suicide note, you're right.
Exactly. And economic harm is real harm. So to me, the question is not, should we do something? Because of course we need to do something about this. The question is, do these massive lockdowns make sense when we can't even necessarily figure out how they're working?
Yeah, I think, Alex, I want to have you back because I think this is, and a lot of people back, this is a rational approach that you're taking. Others are as well, and I think that's the way to make decisions, especially in crisis. I appreciate your coming on tonight. Thank you.
It's a great pleasure. Thanks.
The New York Times downplayed the coronavirus for
goes down. We have to have in place the ability to do the kind of containment that's pristine. Namely, you can you test like crazy, you identify people, you isolate them, and you do contact tracing. You can't do that when you're in the middle of an explosive situation and you're doing mitigation. But when you get that curve down, it's kind of the restart button. And that's when you really got to make sure you don't ever let it get out of control again. So it isn't declaring victory. It's okay, we won this round, but let's keep it down.
It's a long battle. Dr. Fauci, I appreciate all you're doing, and we know your time is valuable. Thanks for being with us.
Thank you.
Good to be with you guys.
Up next, we're going to check in with one of the first volunteers to receive an experimental coronavirus vaccine.
At Fisher Investments, we do things differently and other money managers don't understand.
You can sell your policy.
Like, it's amazing. Holy words I can't say on camera.
1919, they came and went with a great deal of speed. Another one is the geographic differential, that it didn't hit every place in the state in the same way, and I'm sure there's a lot more research that could be done on that. Another is the slowness with which some public officials figured out what was going on and what to do. And that took a while for it to sink in, and once it sank in, it was almost too late. These kinds of things, the mysteriousness of the whole thing, how little was known then and even today about why it arose so quickly and why then it disappeared so quickly. Then you think about, as the first explorers and travelers, fur traders up the Missouri River came, they brought their diseases with them and infected a lot of the Indian tribes, which killed as many as half or more of them in a short period of time. There were also the cholera epidemics of the 1830s and 1850s and 1810s that would have had some effect or other, but it's hard to know because there really aren't many written records about that in the area. One thing that needs to be said is that there's been very little written about this. The standard textbook on South Dakota history, Herbert Shell, has nothing about the flu epidemic. Robert Carl Levitz tells us that the Spanish flu killed 1,093 people, according to the State Board of Health. Well, as a historian, we always like to think that there are lessons to be learned from history. I think just paying attention, being aware, and using our imaginations to think about what the possibilities are, and perhaps getting prepared for things so that we know how to react when they occur.
See a doctor. CNN's new podcast has answers. Join Dr. Sanjay Gupta for Coronavirus, Fact versus Fiction. Listen on Apple Podcasts or wherever you get your favorite podcasts.
Starting out at Midco, I really had no idea about technical support with a cosmetology background.
KELO.com to get living spaces provide a greater sense of privacy and dignity, and our state-of-the-art.
They are both beautiful and practical things, and the main
Summer 2020, so that we can serve even more individuals in the Sioux Empire. The new St. Francis House, more space, more services, moving people from homelessness to hope.
And I just wonder how you all feel about your dad and his giving you this music as you were growing up.
Well, I think that the most important thing about Dad is really not that he drilled us in music, but more so he made us see life in a certain way. We have a certain outlook on how we're supposed to carry ourselves in the world and how we should see other people and treat other people that I think really has a profound effect on what we play musically. And I think that's really more important than anything that he's ever given us.
Ellis Marsalis was a jazz legend, as you can see there. The patriarch of a musical family, famous throughout American life, often described as jazz's royal family. Last night came word that Ellis, age 85, had died from complications of COVID-19 in his beloved hometown of New Orleans. One of more than 5,000 Americans who have now lost their life due to this virus. Each one a full world, a full universe. The scope and the magnitude of these losses and this grief are slowly dawning on all of us, slowly coming into focus for us as a society. This week we also lost Dr. Frank Gabrin, a two-time cancer survivor who worked in New Jersey as an emergency room doctor treating patients with disease basically until his dying days. And Hilda Churchill, who is nearly 109 years old. She lived a remarkable life. She survived the 1918 flu pandemic, which actually killed her baby sister, as well as 2 world wars. We also lost Romy Cohn, who during World War II saved 56 families from the Nazis in what was then Czechoslovakia. He joined the underground resistance there when he was just 15 years old. And Des Anne Romain, just 36 years old, 36, a woman who emigrated to New York as a teenager, became the principal of Brooklyn Democracy Academy, where she was beloved by teachers and by students. And then there's the legendary playwright and author Terrence McNally, an out gay man who wrote about gay life in America, particularly surviving the AIDS epidemic. McNally was a cancer survivor who last year won a Tony Award for Lifetime Achievement in the theater. He died last week of complications from coronavirus at age 81.
I think the most imperative message of art is live. Be involved with life, live it fully, connect with other people, engage with the world around you, and do something, matter.
Allergies with nasal congestion make it feel impossible to breathe? Get relief behind the counter with Claritin.
Book a ticket to Wuhan, racist! Somehow telling the public the coronavirus was no big deal didn't in the end contain the virus, so the Times went to step 3, politicize the crisis. Calling the coronavirus the Chinese virus or the Wuhan virus is bigotry, the paper will tell you, but they had no problem on February 26th publishing an op-ed saying, quote, let's call it Trump virus. And then last week, in a shameful moment that will live forever in infamy, the paper declared, and I'm quoting, the road to coronavirus hell was paved by evangelicals. Yeah, that's right. A pandemic that emerged from an atheist country is really the fault of Christians, says the New York Times. That tells you a lot about where they are. And now this week, the paper has settled on its favorite step. Step 4, blame Fox News. Of course, because there's a political strategy here. Last week, they warned about, quote, Fox's fake news contagion. Then there was yesterday's article. Talk about a lie. The show is telling you about the dangers of this disease way back in January when the Times was still wondering if it was racist to even know it existed and encouraging you to travel to Wuhan on vacation. Now, we're highlighting the continued dishonesty and malevolence of China. Meanwhile, the New York Times and their star reporter Donald McNeil is going over to MSNBC to deliver unpaid infomercials for the Chinese Communist Party. Watch this.
In China, there are 40,000 doctors, nurses, and respiratory technicians went from all over China to Wuhan and helped the Wuhan doctors fight the virus. There's no more virus in Wuhan. Those doctors have all gone home. There have been victory parades for them, gratitude, flowers, and everything. They're heroes. They not only have the skills, a lot of them caught the virus and are now immune, so they can do a lot of things that would be dangerous for somebody who hasn't got the virus to do. I don't see why we couldn't hire for our pandemic a lot of those doctors, nurses, respiratory technicians.
So, if you're Donald McNeil's editor and you're watching this, aren't you calling his, his supervisor saying, bring McNeil in, he's giving away the truth? What a shill. Bring in Chinese doctors to run our hospital. That's his take. That's not surprising, though. Apparently Chinese doctors already run the New York Times. Well, the new unemployment figures are horrifying. They're the largest in American history, almost by an order of magnitude. In 2 weeks, 10 million people have lost their jobs. Even more jobs will be lost soon. So where exactly are we headed, and what can we do to stem the bleeding at this point? People are getting worried, and they should. Melissa Francis hosts After the Bell on Fox Business. She joins us tonight.
To prevent ourselves from getting COVID-19 and spreading it to other people.
Sanjay, realistic? I mean, you think that timeline, a year and a half?
Yeah, I mean, look, I think Dr. Fauci and others have been very consistent on that. Two things to keep in mind. I mean, sometimes, to create a vaccine, Anderson, it can take 10 years. I mean, there have been vaccines that have taken that long. So this is still a fast timeline. And, you brought up with Neil this idea that there's some risk involved. One of the things that they got to be really careful about is that this vaccine doesn't cause something known as sensitization, which basically means that the next time Neil or somebody who's been vaccinated sees the coronavirus, their body actually overreacts to it. They have a huge sort of response, which can sometimes be deadlier than the infection itself. So it's that sensitization thing that they want to make sure doesn't occur right now. It just takes a while to prove that, Anderson.
I want to get to viewer questions. Sanjay, Karen Rathman in San Francisco sent in this video. Let's take a look.
After 14 days, 2 families have stayed apart and self-quarantined by family at home for the entire 14 days. No member of either family shows signs of having the coronavirus. Is it safe for the 2 families to be together now in one home rather than continuing to be separated?
Sanjay, what do you think?
That was like one of those SAT questions, right? Yeah, 14 days, 2 families.
Traveling 14 miles at 12 miles an hour.
Yeah, so here's how I would answer that, and I'm curious if Lena would agree with me, but 14 days, that comes up because that's sort of the time between when you've been exposed and when you might develop symptoms. It's not a perfect number because, Anderson, as you and I know, we interviewed somebody who had the virus in their system longer than that, but 14 days is a good number. If they haven't had any symptoms yet, they should be pretty much in the clear. And I think it's okay to be back together. Maybe that'll make quarantining a little bit easier for them.
It's how we know how many tests we're doing. And Alexis Madrigal joins me now. Alexis, we saw this really impressive effort. We started way behind. We were behind the 8 ball. Testing has ramped up quite a bit. It seems sort of stuck now. Where are we right now, and what are the obstacles to getting it further up?
Yeah, we're doing about 100,000 tests a day, a little more today, a little fewer over the past few days. It is a big ramp up, but it's also not as much as we need. And there are key supply chain constraints and swabs and then the chemicals that are used to do the tests. And there's also incredible variability across the country. And also, most likely, there are some real inequities in who's able to access these tests.
Welcome again to our CNN Global Town Hall. Coronavirus Facts and Fears. This is our 5th Town Hall. In just the last hour, the cases have risen and the number of dead in the United States has also increased. There are now 243,453 positive cases in America and 5,926 people have died. That's more than 1,000 new cases and 76 more people who have died. In this second hour, we're going to be joined by New York's Governor Andrew Cuomo to talk about the fight to secure ventilators for his state and also about states unlike his that still don't have stay-at-home orders in effect. Also, we'll talk to Robert Kraft, owner of the New England Patriots. His Patriots have helped secure more than 1 million masks for Massachusetts and 300,000 more for New York. Also, we'll talk to experts who are going to answer more of your questions about the medical and psychological impact of this pandemic.
Now, usually at 9 p.m., Chris Cuomo is anchoring his program. Of course, he's now suffering, as you probably know, from the coronavirus. So before we do anything this hour, we want to check in with Chris. How you doing,
Chris? How you feeling?
I'm doing well. The beast comes at night. You know, as we know, the healthcare workers have taken to calling the virus the beast. I understand why. My fever has gone up a couple of degrees in like the last 30 minutes. Nights are tough. And I've learned something that I didn't know before. It is responsible journalism to say that 80% of people who get this statistically wind up okay, meaning they don't go to the hospital, they get through it. It is not humanly responsible, though, from an ethical perspective. Now that I'm one of the anointed, and these people reach out to me, you suffer when you have this at home, unless you are ridiculously lucky statistically and maybe karmically as well. I can't tell you how many stories I've had of people who have had over 100, 102 fever for 8, 10, 12 days. And just to tell you what kind of toll that can take, look, it's not about life or death. I don't mean it that way. Otherwise, I wouldn't be doing the show. I'm not looking to scare people. I'm trying to do the opposite. I've lost 13 pounds in 3 days. Wow. Now, I'm a big guy. I started off at 230 pounds. My wife is feeding me like, you know, we were still in the dating phase. You know, so it's not like I'm hurt for nutrition. I'm eating and drinking constantly. I'm just sweating it out, and it's the sickness. So, yeah, 80%, we're going to make it through. But the idea that it's easy, so you can be nonchalant, that is so misleading, fellas. That I now know for fact.
Are you saying she fed you better in the dating phase?
Oh, yeah.
Okay, well, that's a whole other story.
That's a whole other situation, Anderson. I can't. That'll take us a long time.
Hey, Chris, I just need to say for the record, I think Anderson agreed with me. We had suggested you not work right now. I mean, I know you're incapable of not working and talking about this, but just for the record, we did suggest that. I do have a question though for you, because you know you're a journalist and now you're dealing with this for real time. And you're probably always trying to figure out how to take care of yourself and digging like a journalist does. What are you learning? I mean, you're really in it now. Have you learned anything that works for you?
Here's what I know: that the chicken soup is not just anecdotal. You look online, even if you go to JAMA, you know, the Journal of American, you know, go to the Medical Association Journal. That has worked for me, I believe. I believe that it has helped me lower my fever in periods. I have been counseled to try to endure fever as much as I can because the fever is the body's fighting mechanism. Now, what I've also learned is there is so much BS on the internet that people are trying to peddle as cures, fake pills, fake tonics, these mixtures of things that are actually decent ingredients. Vitamin C, vitamin D are great supplements to have, but 10,000, 20,000 units they want you to take of this. You're not going to overdose, but you know, it can be really hard on your system. People are selling a lot of lies, and people are buying them up because of the desperation, and I get it, but they don't work. There's no proof in any of them, and I think we have to be very careful about people preying on desperation.
So what do you anticipate tonight? I mean, you talked earlier with the governor, with your brother, and we revealed that he came to you in a ballet costume with a wand during the bad night you had last night. What does a night look like for you? You said your fever is spiked. What do you think your fever is about right now?
Well, I could probably tell you if you want, but it's probably around 101-ish. Now, I run a little cool. My normal temperature is 97.6, not 98.6. So even when I'm at 99, that would not be a big deal for most people. But for me, I'm already warm. So what happens is at night, you know, your body temperature goes up in the late afternoon anyway. This is, you know, anybody with a kid, you know, knows that dance. But I will get pain in my face now, headaches, profuse sweating. Literally, my vision in my left eye is a little blurry from pressure, from sinus pressure, and some manifestation of the virus. I've talked to several clinicians and experts in this. They've all said it's a very common thing. And then you can't sleep because you have a fever. And you have these wicked phantasmagorical experiences that are not dreams. When I say I saw my father sitting on the edge of the bed, I would have gladly raised my hand as an affiant and testified to it under oath easily. Why? Because of the fever, because your body's all screwed up. So what I'm saying is, yeah, I'm going to make fun of some of this stuff, but it isn't funny when you're living it for people, and I do not mean to dismiss their pain. I'm just trying to help people not be too spooked, because everybody's so spooked about getting this that if I get it, what will happen? You'll survive. But at the same time, if you think you're going to take the social distancing lightly, or you're going to be nonchalant with any of the beautiful things that Sanjay laid out in that video, I am asking them to send me a copy of your video, Sanjay, because Christina has been going through those protocols in the house. You know, she's taking care of all of us right now, and it's so important to do everything the right way. Otherwise, you wind up exposing yourself. But I'm just telling you, Anderson, you'd make it. But it's so hard that to say, it's nothing, don't worry about it, is totally disingenuous, because you are going to experience things you likely never have.
I'm glad you said, because part of me has thought, you know, I'd rather just get this now and get it over with. And I mentioned that to my doctor the other day, and my doctor was like, that's idiotic. You don't want to get this at all, obviously.
Look, I wish I would have gotten it sooner, but, you know, so I could have told this stuff to people a month and a half ago, and we could have broken this bubble of everything's going to be okay, you know. And obviously, I'd always rather have it than any of the people in my family. And thank God they're still they're still asymptomatic. But you don't want it, brother. I tell you that.
Yeah, I mean, it's funny. We talk about, you know, the numbers of people who lived and people who have died, but, you know, this is the in-between part, which can be pretty brutal. I mean, you know, Chris, it's interesting because obviously you're here talking to us. You were at your brother's briefing today. He said that he thinks that you having the virus is going to be a great public service. And I think he was being honest. I don't think he was being ironic when he said that. But, I mean, what is it? Is that your goal here? I mean, right now, talking to us even?
Yeah, it's my only goal. Because in between doing this hit or doing my show, sorry about the phone call, you know, we have a gate at the house that we're renting. So every time somebody drops something off, the thing goes off. Sorry about it. Anyway, I can't let anybody in the house. You know what I mean? They can't come through the gate because I don't want to get them to expose anything. In between the hits and in between when I'm doing the show, I am a waste. I sleep probably 10 hours of the day, if I can, you know, in and out. I try to walk and do these breathing exercises because I'm petrified of getting pneumonia. I have a really good friend who had the same symptoms I did. She's every bit as strong, if not in better shape than I am. And she had 3-4 days good. And now she's got this thing attached to her face that I never want to see in person, let alone have. And it scared the hell out of me because the unknown is frightening. And you lose any illusions about yourself real fast. And I'm hoping that people see, all right, he's making it. But he's not full of it either. He's not telling me this is some cakewalk, because that would be a lie. And I want people to know that you can deal with it if you get it. Don't be so afraid of this virus that it puts you into a panic and that it keeps you from making smart decisions. Conversely, don't make reckless decisions either because you think you'll breeze through. I haven't heard of anybody who has.
And Chris, just quickly, I know we're running out of time, but I mean, again, because I want people to realize that, and we talk even after the show, so people are checking in on you because, you know, people are really worried. But you also have an oxygen monitor as well, is that right? I mean, you are checking your own oxygenation.
Yes.
What is that for?
So it's really important, Anderson, thank you. It gives you 2 measurements. You put your finger in it, it's an infrared. They're like sold out now. People sent me a bunch. I'm trying to get them at the office so I can give them to people. People have been so generous, man. I got to tell you, when we say that in the worst of times, the best of us comes out, it is so much more true than it is just trite. And what it does is you put your finger in it, and you have to have warm fingers. And as my doctor explained it to me in a very funny way, she said, you should take it the way somebody takes a marriage proposal. Never go with the first offer. Always work it a little bit. So when you put your finger in it, you'll get your blood oxygen level. You need it to be above 94 or so. But it may not be because it's infrared and it's not precise. So you do it a few times. And it tells you what the percentage of oxygenated blood is that you have. And if it's below 94, you're starting to get into an area of potential distress. And it gives you that and your heartbeat. The heartbeat is not as sensitive unless you're in a labored breathing situation. But I check it 8-9 times a day.
Chris, we wish you the best, and I hope tonight's not as bad as last night.
And I hope if I have to have somebody dancing around doing funny things, it's neither of you two guys, because I don't want to have that image in my head. No, listen, thank you. And thank you for giving me the opportunity to tell people it's not a cakewalk, but we can get through it. And if you don't have people around you to take care of you the way I'm blessed to have, reach out to people who you know who have this. Do whatever you can to help.
And just to be clear, I mean, you don't know necessarily how you got this. I mean, you were doing as much as anybody on social distancing and stuff, right?
Probably no, because of the job. You know, I mean, I was talking to a lot of people and going to places, and I was not thinking that I wouldn't get this. I thought I would get it. But I was not going out of my way to be a fool about it. You know, I mean, I was trying to do things that are reasonable within the lines of what our work is, especially given the situation I'm in with the state right now. Like when I do have a couple of good hours, I'm still trying to help with procurement for the state, because they really are fighting state by state, which is so stupid, to get the equipment that they need. So I don't know how I got it. And most people don't, Anderson. And we're so far behind on testing. We're telling ourselves these lies about testing. We're nowhere near where we need to be. And we're not going to be in this wave. So nobody knows how they got it, really.
Yeah. Chris, thank you very much.
Call you later.
Chris is a perfect example of how the virus is spreading. No known contacts, following as much as possible social distancing, health guidelines, still contracting it. As we've been reporting, there are now more than 1 million cases worldwide. If you have questions, tweet them at the hashtag CNN Town Hall. At the bottom of your screen, you'll see our social media scroll. It's a good time to bring in Dr. Maria Van Kerkhove, who's the technical